Exercise for chronic hip pain. Please consult your primary care provider or physical therapist before starting an exercise program. This video is designed to help you perform the correct technique of exercises that have been given to you by your healthcare professional. This strengthening and stretching program is designed to increase your strength and flexibility so that you can perform more activities you enjoy with less effort. Choose a time of day that best fits your daily routine. Please contact your primary care provider or physical therapist if you have questions or concerns. Bridging. Begin by lying on a bed or mat on the floor. Bend your hips and knees so that your feet are on the floor or mat, hip distance apart. Gently tighten your abdominal and buttock muscles. Raise your buttocks off the floor or bed to create a bridge. Be sure to breathe normally as you complete the exercise. Repeat this for 10 repetitions for 3 sets, 3 to 5 times a week. Common errors. Moving your pelvis during the exercise. Be sure to keep your pelvis in a neutral position. Don't let your pelvis drop or your back flatten or overarch. Side straight leg raise. Begin by lying on your side on a bed or a mat on the floor. Bend your bottom leg for support during the exercise. Your top leg should be in line with your shoulders and hips. There should not be a bend at the hip of your top leg. Tighten the muscle on the front of your thigh and slowly raise your top leg up 6 to 8 inches. Keep your knee straight as you lift. Lift and lower slowly and in control. Be sure to breathe normally as you complete the exercise. Repeat the exercise on the opposite leg. Repeat the exercise on each leg for 10 repetitions for 3 sets, 3 to 5 times per week. Common error. Roll your hips forward or back. Don't let your hips roll forward or back as you lift. Keep your leg in line with your shoulders and hips. Seated hamstring. Begin by sitting on a sturdy chair on a non-slip surface. Bend one knee, putting one foot flat on the floor. Straighten your other leg, putting your heel on the floor. Tighten your abdominal muscles to keep your back and hips in a stable position. Gently lean forward from your hips until a stretch is felt behind the straight thigh. Breathe normally as you hold the stretch for 30 seconds. Repeat 3 times on each side. This stretch may be done daily. Here is an alternate position to stretch your hamstring. Lying down on your back, raise your leg and hold the back of your thigh until a stretch is felt behind your knee and thigh. Common error. Letting your back round as you bend at your hips. Letting your back round as you stretch. Overstretching. When bending forward, you can probably go farther as you let your back round, but this does not allow you to stretch the correct muscle on the back of your thigh. Remember to tighten your abdominals to support your back. Don't let your back round. Keep your gaze forward. Feel a mild stretch behind your knee or thigh. Single leg stance. Stand in a counter or sturdy chair on a non-slip surface. Use the counter or chair for support during the balance exercise. Lift one foot off the floor, standing on the other leg. Keep your hips level like headlights on a car. You should feel the muscles working on the side of your hip that you're standing on. Hold for 30 seconds and then place your foot on the floor. Repeat this exercise for 3 repetitions on each leg, 3 to 5 times per week on each side. Breathe normally as you do the exercise. Common error. Don't let go of the counter or chair when completing the exercise. You want to be safe and stable when doing this exercise. You may do this exercise while brushing your teeth or doing dishes so that it fits into your regular routine. Regular routine. Hip flexor stretch. Begin the exercise in standing with a chair without armrests on a non-slip surface. Turn the back of the chair to the side. Use the chair back for balance if needed. Stand on one leg and place the other leg on a sturdy chair. Tighten your abdominal muscles. Breathe normally and gently lean your body forward until a stretch is felt in the front of your hip on the leg that is straight. Breathe normally and hold the stretch for 30 seconds and repeat 3 times on each leg. This stretch may be done daily. Common error. Bending your knee too much. Bending at your hips and lower back. Prevent knee stress by checking that your knee on the chair is not in front of your toes. Keep your body upright so that you can feel a stretch in the front of your hip on your standing leg. Quad stretch. Begin the exercise in standing with 2 chairs on a non-slip surface or a counter and a chair. Stand on one leg, holding on to the back of one chair or counter, and bend your other knee so your one foot is on a surface or chair behind you. Feel a gentle stretch in the front of your thigh. Breathe normally and hold the stretch for 30 seconds and repeat 3 times. This stretch may be done daily. Common error: using a surface that is too high. If you feel a cramp in the back of your bent leg, the surface is too high. It is important to keep your knee pointed to the floor.